So I'm going to talk about that, the role of the nurse. I've nothing to disclose. So, as we know, long-term follow-up care is important for childhood, adolescent and young adult cancer survivors due to the risk of late effects. Prevention, early detection and management of late effects are recommended to improve the quality of survivorship. So my plan for today is to talk to you a little bit about survivorship, our long-term follow-up clinic in Ireland, hence the Shamrock, the role of the nurse and transition and the passport. So when do you become a cancer survivor, Patricia? Cancer survivorship begins at the time of diagnosis and continues until the end of life. These are two reports that came out in Ireland recently, the National Cancer Strategy in 2017, and one of its priorities was to look at survivorship. Following on from this, we have a National Cancer Control Programme who carried out a needs analysis assessment involving patients, parents and professionals to look at survivorship after childhood cancer. And following on from this, which I haven't included in the slide, is a subgroup who's been set up to look at the services that are provided in Ireland and to provide equity, and also hopefully that each survivor will have a medical summary going forward and take ownership of their own care. So the Irish 5-year survival rate is at 81%, which is comparable with the international standards in high-income countries. And as we've heard many times over the last few days, survivorship in the low and middle-income countries is at 20%. So, late effects of cancer treatment. The cost. It's a double-edged sword. Cost includes serious and life-threatening illnesses, second malignancy and psychological morbidity. Treatment is in conflict with normal childhood growth and development. Therefore, survivors and their families have significant ongoing needs for supportive care. So, in Ireland, we set up our long-term follow-up clinic in February 2008. I'll talk to you briefly about our patient cohort and our referral pathway. So, admission to the long-term follow-up clinic occurs when the patients are greater than or equal to 2 years in complete remission from the end of treatment and or greater than 5 years from diagnosis. A medical summary is completed by the medical team, mainly, before entry into the clinic. So, the provision of the service is to review prior disease history and treatments, as we have heard, identify late effects and the risk of late effects, to develop a surveillance plan, to evaluate these symptoms and coordinate with the multidisciplinary team. Psychosocial support is also provided in the aim for counselling in relation to school or work issues, disease prevention and health promotion. So, our haematology patient referral pathway. So, our leukemic and acute myeloid leukemia patients are seen for every 3 months by 1 year, every 6 months by 1 year, and annually for 3 years. They graduate to follow-up greater than 5 years back to their GP for the acute lymphoblastic leukemia patients. Our acute myeloid patients are referred onto their GP at 10 years. The older patients, if they're diagnosed, are seen for less than 5 years, obviously, in the children's setting. And then at 5 years, or if older than 5 years, referred back to the adult hospital. Our transplant patients, they're seen every 6 months until 2 years post-transplant, annually then for 5 years, and every second year thereafter. And at 17 years, they're referred to the adult hospital. So, I've discussed the malignant haematology. The solid tumour cohort, which is what I'm mainly involved with, are patients with neuro-oncology conditions are seen in the neuro-oncology clinic up until the age of 17 or 18 years of age. And our patients with extracranial tumours are seen in the long-term follow-up clinic. So the levels of care for long-term survivors, which I'm sure many of us in this room are aware of, are level 1 are patients who've had surgery alone or low-risk chemotherapy, And examples of these conditions are Williams stage 1 and 2, or germ cell tumours. Level 2 are those who receive chemotherapy, radiotherapy, or both. And examples of these conditions are patients who have had brain tumours, post-transplant, or stage 4 tumours. So our levels of care for survivors of the solid tumours, they're followed up for 3 to 5 years. Level 1 are referred back to their GP. Level 2 are followed up until they're 17 or 18. Some are referred back to their GP, and I'm sure that'll be a question. And some are, if they have neuro-oncology conditions, they're referred on to a radiation oncologist, plus or minus a neurosurgeon. Patients who've had an autologous transplant are referred on to the adult hematology oncology. And patients with extracranial tumours are also referred on to adult oncology. So our needs of our survivors. Late effects can occur at any time following treatment, and it is important to consider approaches to monitoring, supporting, and clinically managing these patients. Evidence suggests that these patients require monitoring for many years, and some require specialist care for the rest of their lives. And others, as we know, may need support to reach a degree of self-monitoring and responsibility for their own health needs. So, the focus of the long-term follow-up clinic visit is surveillance for signs of cancer recurrence, to identify, prevent, and control any long-term physical or late effects associated with cancer and its treatments, and health promotion and education. The role of the nurse. So the role of the nurse, these are just 3 slides, 3 circles with the survivor in the middle. The aim is health promotion, so therefore we assess actual and potential late effects. We encourage self-care and support self-monitoring. We liaise with the multidisciplinary team to optimise holistic care and also participate in education programmes in late effects. Transition, as my parents said, wasn't seamless, but we try. To develop individualised treatment summaries and care plans to support the smooth transition of care. Create services that can work in conjunction with or link in with the community, the GP, the public health nurse. Transition, as we know, from childhood to adulthood is a time of self-identity, independence, when new work and social roles are developing. Education, our most important tool. To provide information, support and advice to children, young people and their families. We link in with the schools to provide extra support, and we have 2 programmes, the DARE and the HEAR, that are available. Demonstrate knowledge of the impact and its treatment on their psychosocial development of children and young people. We initiate or cooperate in research, audit and service provision. And as we heard, education includes survivors, families and carers. The aim of this is to increase awareness and knowledge about cancer and treatment. About cancer and treatment-related risks of late effects and the importance of the long-term follow-up clinic. So the benefit to the patient, this is just a conclusion slide of what I've just said. So they've identified clinical need, nurse, they've timely access to service, we provide education and health promotion, we're there for the patient and family. We try to promote independence, but that's difficult, and continuity of care. So transition from paediatric care. Patients are given a handheld medical summary detailing their diagnosis, their treatment, their problems and recent investigations. It isn't really always a handheld medical summary. It can be given electronically if the patients want to give us their email address. They're graduated from paediatric long-term follow-up as described earlier. They are given this summary or a transplant letter, depending on their treatment. We also give them information sheets and help links related to the treatment that they have received. So, in conclusion, treatment-related complications are common. Chronic problems may not manifest for many years. so long-term follow-up care is required for life. Risk-based healthcare assessment is given with a personalised plan upon discharge from paediatric follow-up. And additionally, long-term follow-up care provides an opportunity to offer age-appropriate information about disease treatment and healthy lifestyle, as well as practical advice about insurance, education or work and psychosocial support. And as my quote says, children are undeniably essential to the future of our society. Healthy children become healthy adults, and events in childhood and adolescence have long-term effects that determine well-being in adulthood. I want to thank my team in Crumlin. I want to thank my colleague, Catherine O'Brien, who's our survivorship AMP in St James's Hospital. Thank you.